During this Man on the Move, I am very pleased to come to you from the Resident Lounge with Dr. Lori Winston. Dr. Winston is the GME Program Director over Emergency Medicine. She herself is an emergency medicine physician. Dr. Winston, today is a very important day. We have the beginning of our residency program. Tell us how you feel about the commencement of residency programs at Kaweah Delta.
We are so excited that today is the first day. We've been planning for years now, and it's all coming to fruition. We have 6 emergency medicine residents starting. They're all boys this year. We're excited that the program is a very good experience for them in that the patient pathology and the number of patients, and everyone is excited to see them and have them start working.
So you actually think emergency department services at Kaweah Delta will have enough clinical work for them to do, huh?
Oh, and then some.
We're just kidding about that, of course. Tell us, what will be the actual experience of the resident in the emergency program?
After they go through this initial orientation period where they get certified in all things that they need to be certified in, they have 2 weeks in the emergency department, and then they do rotations all over the hospital. So they'll be in the emergency department, they'll be in the ICU, they'll be on trauma surgery, they'll be on pediatrics, anesthesia, and orthopedics. And then the next year, through their training, they go through all of the rotations, but that's their very first year, and inpatient medicine.
So our staff and our physicians can expect to see these residents outside of the emergency department.
Correct. On the floor, you'll recognize them on their coats. It'll say what program they're from. Their badge will identify them as a resident physician, and they are able to write notes, write orders, and function as a physician with the supervising attendings all over the hospital.
Fabulous. Now, Dr. Winston, maybe you can tell us a little bit about how the program grows. We have 6 this year. Over the next years, how do you see the program developing, and how many residents will we have ultimately?
We have 6 residents per year. The program is 3 years long, so after 3 years we'll have 18 emergency medicine residents, and then 6 will graduate and 6 more will come. And if you ask me, we're interested in making it even bigger because there's so much to do here.
Wonderful. And I learned just this morning that ultimately across all of our graduate medical education programs, after 3 years, we'll have some 76 physicians and their families here in Visalia. What a wonderful boost to the medical care that is needed in this community and for the training process of these wonderful new physicians. Dr. Winston, I want to personally thank you for not only the interview, but some tremendously hard work that's been done by you personally in bringing this emergency medicine residency about. Thank you, and thank you for joining me for this Man on the Move.
Thank you.